How to perform a sit stand. So the first thing we want to do is take the shoulders off the back of the chair. So we can ask Marlene to do that. If she can't do it, we're going to put our hand in the hollow and on the shoulder blade and use rotational movement. So pull in towards us and step forward. If Marlene can't sustain this position, we wouldn't take this technique any further because she has to have sitting balance to be able to stand. We're going to move the hips from the back of the chair to the front of the chair to make it easier for Marlene to get up. So what we want to do is take the weight off of the side we're working on. Put your hand on the hip, behind the hip, and your hand just above the knee. So we're going to lift the knee and pull the hip forward, and then go down to the other side. Weight off the side we're working on, and you want to lift the knee and push the hip forward. And we'll do that as often as we're required to get the bottom to the front of the chair. Once the person's at the front of the chair, what we need to think about is, do they have a sided weakness? If they do, we're going to support the weak side, and also we're going to get them to place their weak foot out in front of them so that the strongest foot is underneath them, which allows them to drive with the most amount of power. So Karen's going to place her hand on the hip, far away hip, and on the shoulder, lowering your centre of gravity, and then we're going to ask Marlene to put her hands in the arms of the chair, and we're going to push up on 3. So we're rocking forward 1, back 2, stand in 3. And we want to stand with her so that we can make sure that we're keeping our spine in nice alignment.